Okay, so benefits of using VR for simulation training. I want to kind of go over just some different ones that I've used in the past. Here is you were taking. I think people were doing breathing sounds on a patient, and so you can see that he's checking her for lung sounds. But it's definitely a game changer. You're allowed to not only make mistakes, but in turn learn from those mistakes and then repeat the skill until you are better or until it's perfected. It's a new way of learning for sure. But in all simulations that I've had the privilege to be a part of, we had nothing but glowing reviews of the training. Well, I don't think this will replace clinical training or mannequin training. I do believe it's another huge, useful tool to educate healthcare staff of today and in the future. Students have stated that while they're having fun in the headset, they're also learning, and that while it's stressful, it took some stress off knowing that if they made a mistake, they could go back and learn from it without harming a patient. So that's ideal. A lot of people are not only using this for, nursing training or EMS training or military training, but medical staff is using this to look at different kinds of, or look at patient charts or patient, like, for example, a guy I know or a doctor I know has been looking at how to operate on like doing brain surgery, and he is not only showing how to fly through for him to cut out the tumor, but also showing his patients. So putting them in the headset and them being able to see what he is actually going to go and do is super helpful and just nice for that patient feedback. So you can do a ton of things. You can do practice and learn skills and procedures. Pretty much everything is out there. There's obviously weird cases that you can do custom scenarios with different companies. I will tell you they cost more if you want custom, but there are over 100 companies that are doing this sort of thing. From what I've gathered, and that who's who list will come out today. What I've gathered, it's almost every place does something different. Either their software is different, or their metrics measuring is different, or they have different case scenarios. But when I started 7 years ago, there was not near as many cases as there are today. And so everyone's kind of, getting into this space now. Sorry. So why do you ask? Is this just another simulation, or what are the benefits? It drastically reduces costs. So while you may have mannequins already, it's significantly cheaper than buying another mannequin. Eventually, as you can see here on the screen, eventually we'll get to the point where like Oculus is also doing pass-through or augmented reality, like with the Apple product that's coming out, or Vive. A friend of mine, Professor Bob Stone in England, he actually retrofitted a Vive to have a web camera on it. And so as you can see, he's actually using a mannequin in this simulation, and he's in a space that they've custom built. It's the back of a helivac, but it's mimicking the back of a helivac. So what he did is they are using the mannequin that they already have, and then the software that he has overlays the software onto the space. And so you can kind of see on the right, it's all digital, but the mannequin is real. So he's actually using an actual mannequin to do this procedure on while being in a virtual environment. So this is a kind of mixed reality or an XR reality application. And this, he actually has a white paper on it. And he was one of the first guys I ever met doing virtual reality. And he has shared the world. He isn't charging for it. He can show you how to attach a camera onto the Vive. And it's actually, the British Air Force is actually using it. So it's a very cool experience. It's something that's different. So I understand you have mannequins, and eventually in the future, you'll be able to afford all this, and this will just be built into a headset. Increased impact. It's a better learning aid than 2D traditional physical models. You can actually interact with the simulation. So you can actually, like within SIMX's experience, you can actually talk to the patient, and the patient will respond via a moderator software that faculty uses to communicate, or to throw different things out there. You can zoom in and out. You can highlight various areas of, like, if you're doing like sterile processing, you can actually highlight what's wrong in that situation, or what's wrong in that room. Or if you had a biocontainment, you could have a hazard that came up, and the people in the simulation would have to figure that out. And so it's just a good way to reinforce a piece of information with visual aids.
Tess,
yeah.
Benjamin has a question. What about other solutions besides Vive as an end device?
So like Oculus is a great end device. Viharo is good. I guess I don't specifically know what you mean. Like if you just want just different headsets, just depends on what your simulation is or what you're looking for that simulation.
Ben, can you unmute yourself and ask her specifically?
Yeah, I especially mean the use for mixed reality, because I've had in recent projects, we always had the challenge to track mannequins in the environment correctly, and we had big issues regarding that. So, do you have any idea on tracking on other devices than Vive?
I don't right now. There are a couple headsets that will, I know Oculus has one that's coming out in 2023 that will have better tracking of outside, like furniture or outside entities like a mannequin. But I am happy to get you in touch with Professor Bob Stone. He would have probably an hour conversation with you about how to do that. And I can send you his white paper as well, and with all the information.
Sure, sounds great. Okay,
great. So also it cuts down on distractions. When someone's immersed in the environment, they aren't listening to their friends, or like, for example, when we had someone, we'd have like a group of students in a simulation room. A couple of people would, be in charge of that situation, where the others are like, oh, I'm just going to let them do it. Well, this is a way that they have to be involved. They can't just sit back and relax and not do anything or not learn anything. So it's a good way to get everyone involved. You can explore different areas. You can improve soft skills. So, anything from donning and doffing, or and I will say on some of these soft skills, like putting an IV in, it's not going to be the same. A lot of these just click on. I mean, you still need those simulation task trainers to actually put an IV in and actually feel, a prick, or feel, where that person's vein is for blood draws or that kind of thing. So you still need those skills too, but this is another way to teach